specialist presentation. Today we're going to be talking about offering support related to infant feeding, which could involve breastfeeding, it could involve formula feeding, bottle feeding, pumping. There's, so much related to feeding and all the feelings that we have about that as parents. And to give you a brief overview of Las Cumbres, we have been operating in Los Alamos for over 50 years now. We actually started, our first building was here, our first office was here in Los Alamos. And we have a wide range of services that for families. We actually offer services in Santa Fe and in Rio Arriba County, and which is basically like the top half of New Mexico. So we love providing services wherever we can. Thanks to a grant by the Los Alamos County, we are able to bring you these Ask a Specialist programs that we will post on YouTube for your viewing pleasure and information. I hesitate to call myself a specialist because I always feel like every child is going to teach me that, I don't know anything. My name is Abby Nelson. I have 4 kids. I'm a mom of 4 kids. I work as a developmental specialist and a service coordinator with the Family Infant Toddler Program, which is the early intervention program that is run through Las Cumbres. And I'd like to turn the time over to Veronica for her to introduce herself. And she's going to introduce a brief overview of feeding and what that looks like for infants.
Avi, thank you very much for the introduction. Yes, so my name is Veronica. I'm a Kanya, and I am a mother of 2 kids too. Currently, I'm working for Las Cumbres at the home visiting program, Confident Parenting, and I'm enjoying my point of view of what I can support in this specific subject. I have done some research and some certifications around feeding, lactation, and I love the subject. I'm passionate about it, and I just want to show you a brief presentation just to kind of talk about the points that we will open up. Mostly my goal today is to leave you with questions, right? So more reflections for the community, because this subject is really political and we can open up for hours and hours of passionate talking with how important this time in life is. So we can start at this point. I'm gonna share the screen. Okay, so really briefly to let you know that yes, of course, I am in this path to become a doula, and this doula full spectrum can assist all of the supports any situation during their fertile life in people's experiences, people's lives. So that can be lactation, suppression, like bottle feeding, relactation, and much more. And what we want to talk about as a specialist, right, is like every parent is unique. Every parent is expert in their babies, and we all come with full spectrum of knowledge so we can apply in our babies, right? So the idea is that our role is to spark that knowledge in every family. So
I love that, the spark.
Yes. Let's spark that knowledge in every family, right? So that's kind of what my goal is today. And because it's so big, the subject, I just kind of put it there. Newborn, what to expect in the first weeks. And then, of course, we can open up more questions. How do birth experiences shape your life's trajectory? If everybody kind of take a pause and think about how it's completely different, right? Trajectory of what it will look like if I didn't have a child, and how it looks like now. So our role as supporters are people from the community that are there to kind of walk with you through this path, is supporting you to honor that journey of becoming a parent, and be those ears to listen, right? If you want to share the story, then we are there, right? To kind of,
and that journey is different for, it could be, your journey to adopt. That is a huge journey, and that's, not excluded from feeding, and the emotional journey that comes with that is very real as well. So I mean, this journey of becoming a parent or deciding not to be a parent, all of that, we want to honor all of that.
Totally. Yes, exactly. And that's why your language also, right? It has to be kind of become more open to adopting parents, or like different ways of becoming a parent at this point in our community, which they are all um challenging, and it can be it can be hard for people. It can be challenging because the wording is not there, and some of the support sometimes can be um I don't know, kind of like the provider maybe is not there, right, to support when they are asking this.
Finding the right provider and finding, like, a support system through this whole process, because if your journey looks different than someone else's journey, you almost need to find a different group of support that,
Right.
to help you through that journey, and people who have been through it before. And
Right.
and actually, that's one of the things I really love about Los Alamos, is that we do have a very active, because a lot of people who move here don't have family nearby, and so there's a very active, parent support in town, which is, if you're looking for a doctor, if you're looking for, um, you know, uh, people who have been through similar experiences, I would say reach out, because there are places and there are people who have been through it, and are eager to support you.
Yes, yes, and becoming a parent is about that, right? It's about asking for help, because we can do it ourselves. I think it's not um we shouldn't accept it that is a journey that we have to go through ourselves, do it ourselves,
Absolutely.
right? Like, so, or
Absolutely.
we need the community. So yeah, like you say, find the right provider, support system that you can keep building, now, before you become a parent, and after, right? Those ones are important. So what to expect in the first, like, very first hours after birth, right? If there is not any medical issue, or everything is fine with mom and baby, very suggested, right? Like, strongly suggested, right after birth, skin with skin. That will support any circumstances, right? Temperature regulation, regulate the temperature, just kind of get bundled up together, and maybe 1 or 2 hours, right, until baby kind of gets into the mood of, maybe I am gonna try to feed, or not, right? But maybe mom is also a little more rested, right? So the idea is to keep yourself hydrated, and the experience can be challenging. It's not, I don't think that it can be, so for some people, kind of just comes up and seems like it's easy, but seems like most of the experiences are really challenging in this part. It's like, oh, what do I do? And like, wow, this
Absolutely. Well,
hey,
they're
this is hard.
exhausted. There's this, exhaustion after, having a baby, or maybe you've had a cesarean section, and that is, and it's, and you're not, or it wasn't expected, or something, went differently than you were expected, because it's all new, and your experience is going to be different than every single one of my experiences with my 4 kids. Everyone's experience is different, but I have to say, one of my favorite things to watch after you have a baby, is if you watch, they're all scrunched up right inside, and all of a sudden all their fingers go like this, and their toes all expand. It's like they're like, there is so much room in the world, and then they're like, it's cold out here.
Right.
So that skin to skin is actually really, it's, I mean, you want to keep that baby warm. It's been at your temperature for, the last 40 weeks or so. And so having that baby, on top, next to you is really great. If you can, if there are medical issues and you can't do it, please do not feel like a failure. It is, when some things are out of your hands, it just is. And it's not like, that baby isn't going to get that that skin to skin with you when they can. So, because most doctors and hospitals recognize the importance of that skin to skin, or if you're giving birth at home, you already know that the skin to skin, and your doula will support you through that. And I actually love doulas. I think they're a great support for any family, however you choose to do a birth.
Yes, everybody deserves a doula, they said.
Yes.
Right?
Like
no, so thank you for that. Of course, right? It's cold out here and it's different and it's noisy and wow, so like cold regulation, right? Skin with skin supports with that cold regulation. And also at some point, not really quick after birth, but like um at some point maybe making some milk, right? That's the third night, the fourth night. We don't see it, lots of milk yet, but we will see colostrum. And I know that most people are familiar with this, but if you are not, like, it's the first milk, I call it medicine too, like the first gift for that baby. And usually birthing parents produce some, usually, right? After they birth their placenta, you will see some colostrum. But sometimes baby can suck because babies are a little too weak or a little too shy or too cold or too sleepy, right? Like sometimes these happen. So in the hospital, if you have the baby at hospital or at home, people birthing workers, right, support people and suggest, but you can maybe express a little in a little spoon or be a breast. The thing is that when you are breastfeeding, when you're gonna introduce this or offer this via breast, sometimes you don't see it and
yeah.
people don't believe it sometimes. So I think this be a spoon or be a little cap, like shot caps, or be a dropper too, sometimes kind of support that baby to, oh, now I'm curious, now I want to eat, now I'm gonna poop my first poop, right? So it's not always possible, but if in the first hours of after birth you can offer this, that would be amazing via any of these vias. What do you
And the
think?
amazing thing about colostrum is it's really, really thick, and it's almost like a serum. And when it comes out, you'll be like, oh, I'm not producing anything. But I'll tell you, just those, 2, milliliters that you get out, like that, if you're pumping, I had a child who they were worried about his blood sugar levels. And I said, okay, you can feed him formula as soon as his blood sugar drops. But it was actually really fascinating to see, because they wanted to, be able to measure how much they were giving him. So I was willing to pump, and so they gave him those, 2 milliliters, and he just passed out. It was just the most amazing thing I've ever seen, because I'd never seen it, because when you're breastfeeding, it's not, you don't get to see it. But I watched him take those 2 from like a little dropper, and they are so packed. The colostrum is so packed full of calories, and it is really thick, and it's not white like milk, like it's yellow.
It's
And so
yellow.
some people call it like liquid gold, is what you'll hear it referred to
Liquid
as.
gold, yeah, it's very
Because
thick.
it's not white, and so, but it really is liquid gold. And so if you have access to a breast pump, that's really a great thing. They do have them at the hospitals. Also, if you want to, a lot of places will rent them to you, and often that's covered by insurance. Or if you want to reach out to borrow one from someone else, I mean, there's like, you buy your own tubing and stuff like that, but the pump itself, is fine to be, borrowed from someone. But there's like, I have to say, a breast pump was something that I found pretty amazing. My mom gifted me one when I had my first baby, and it was a game changer for me in terms of being able to control my flow and control my supply.
Yes, thank you, Abby. See how passionate we are about this? We were like, because it happened to our bodies. It happened to maybe the baby of your auntie, right? But it happened in the community. We see this often, and sometimes it's difficult to talk about it because it's around our bodies. It's around or smells or blood, right? So sometimes it's not that easy to talk. But thank you for sharing that, because colostrum is the gold medicine, the gold milk. And this part is also kind of yours, but I just want to touch base on this, that we need that confidence, right, on making those decisions when the time comes, after birth, before birth, during the birth, raising the child, right? Like that confidence, really important. And building support systems, that is one dream that I have at some point, that I want to have a class for support systems. So to like tell them, like, oh, what is something that you how can you support your birthing parent better, right? So I love the idea that we need to prepare more food, and sometimes takes less flowers, right? Sometimes we bring the flowers, and of course I love flowers, put it there, but also come and bring some nice and warm food, nutritional food, lots of water, lots of good beverage to drink, that support that family, right? Like, and also that the family enjoy it, right? Like the birthing parent also likes, because sometimes they don't like, I don't know, orange juice, but you bring something with the, with this beverage, with that. So ask first, maybe write it, prepare a little before, a little plan, a little conversation before, I think works. And if everything falls apart, at least somebody knew that you will like to be supported that way. Yes, Abby.
Oh, no, I was just going to say that. Absolutely. One of the piece of advice that my mother gave me, which was a brilliant piece of advice that I pass on when I can, is if you are going to try to breastfeed, if you're going to try to, and if that's your choice for feeding, avoid foods that might cause gas, because if it causes gas in an adult, it will cause gas in a baby. And that's problematic. So a lot of times, and now usually that's just in the first like few months, and then kids' little tummies get more mature and they're fine with whatever you eat. But avoid things like anything hard to digest, like broccoli, cabbage, anything that's like those vegetables, or beans. Don't eat beans, you'll regret it. Or anything spicy, because anything that might upset your tummy or upset an adult's tummy will upset baby's tummy. And that's actually something that was brilliant, and that I really took to heart. And I saw it actually in my children, because there's, when you're like, but I want chocolate. And you're like, I'm going to pay for that for 2 days.
Yeah. But I love what you said, that like, if it's not good for the birthing parent, maybe it's not going to be that good for the baby, because seems like, the systems kind of work the same. You're going to have the same immune system. You are passing the same, we need more research around that, because there's lots of research actually around the gases and around how the colostrum actually seals kind of like the stomach a little with these good bacteria. So now, everything that comes after seems like baby is able to digest better, and like poop it out.
Yeah, my last one, I could eat anything with him. I could eat green chili, and it didn't do anything to him. But like my oldest, his little tummy was so delicate. Like he was like, and so it depends on the kid.
Every kid's the baby too.
You'll have a baby that'll totally prove me wrong.
I love that you say that.
That's how it works.
They prove me wrong. He was born to prove me wrong.
They will. They never read the books. Those kids, those babies, they just never read the books, and they don't like do what they're supposed to, because they don't read the books. And that's what I learned, is once I think I know things, I'll have a baby come along that teaches me that I know nothing. And I think
I love it. But you have that love, right? You have that community. Like, at some point you thought like, oh, I'm enough. I'm doing the best I can, right? And taking good sleep sometimes supports the next day activity and the next day routine, because babies takes all day, like 24 hours, right? You are sleeping, but also you are kind of aware of these babies, if baby's breathing, if baby is okay, right? So you don't sleep well, but it's okay. Your adrenaline, all of your hormones are all the way up. So even if that happened at the beginning for some people, try to rest, try to keep drinking water. You are gonna, kind of like feel that tiredness at some point, and you need yourself, right, to be able to take care of this baby. Yes, Abby.
And I was just gonna say, give yourself a little grace, a little, a little respect, and it's okay if dad needs to get up and give the baby a bottle so you can sleep. That's okay. Or if your spouse needs to do that, that's okay. If you have a friend come over and help out, you're not a failure if someone's helping you. It's you can't do everything yourself. That's why we have a community, and that's why we're here to support each other. And so I always say that that's like a really huge one, is having that support system in place. And even if it's someone who just lets you go take a nap, just let me have a nap. Or if you need someone to come over and do dishes, reach out to a friend. And I mean, that's huge, is being able to ask for help and reaching out and finding that community. And building that community can happen before you even start the whole process of bringing a child into your life. So it's a whole different world.
Yes.
It's a whole different world.
It is true. It is true. Please ask for help. One thing that I want to touch really quickly also is like, what will make, like, if the goal, like you said, if you decide to breastfeed, or if you decide to feed with human milk and you're going to pump exclusively, or, whatever you have decided, you need to build and establish your milk supply. Right. So sometimes that is something that I always talk with people in the first weeks, because like, I don't have enough milk. That is something that I hear all the time. And yes, sometimes we don't, sometimes we do, sometimes we have more than we need, right? Like sometimes we overproduce. Like there are both, like, yeah, a couple of extremes. Oh, I did a lot and I donate, or I'm not producing at all or enough, right? So it can be lots of medical conditions for that, but we are not going to talk about this now. It's just like in a very kind of typical situation. So babies create the supply by the demand, right? So like if you offer without a schedule necessarily, but at least, the first 2 weeks offering at least 10 times, 8 times minimum, 10 times, 12. Some kids eat more, 16, I have met. But it's not sustainable. It just happened during the first 2 weeks, and then they kind of start establishing all of that.
And you might be having a different situation where your child's in the NICU, or your child it has a weak suck, and in those cases, things like a breast pump, really, because it simulates that suck, that's what actually causes the production of milk, is the suckling. And so that is what sort of triggers more. I will say, like, drinking a lot of water and getting rest. Who knew? Like sleep, I found that really was a very big important aspect of building milk supply, was sleep.
Totally. Seems like when you sleep, then all of the energy that you need to make that milk kind of comes back and pumps up, right? So yeah, pumping is one. It's just that at the beginning, I mean, pumping is great every time that you are able to do it. But don't get overtired, right? If that is something that you just put extra, so you are supplying, or you're offering breasts to your baby like every, I don't know, no, like 10 times a day, and then over that you are pumping twice or 3 times, maybe like the question is like, why do you need that now, right? Is that something that you need it now? Is something that you are thinking because you want to put your fridge, you want to have your storage there for milk, or because you can start oversupplying too? And that is also something that is a different subject completely, right? Is something that it happened to people too. But like in the first 2 weeks, establish the milk supply and see what is your goal. Like, what is your goal? You have to go back to work. Do you have to you definitely don't want to do night shifts, for example, like, oh, I want to do 1 shift, yes, 1 shift, no, I want to sleep, there's second babies, third babies, right, Abby? So every baby in every case is unique, and the most important thing is that you find your rhythm And if your goal is breastfeeding or feeding with exclusively your milk or both, establish milk supply, because that the begin like establishing milk supply will be something that gets you through it, right? So, but if you don't do it, then how do we? Then we relactate, which is a completely different subject too. But what is something you want to say, Abby?
Oh, I honestly, I think you're covering it so well. I think I would like to touch on that. I know we put these expectations on ourselves and what we plan when we have a baby, and you never know what your baby has planned for you. I know I plan to nurse with my oldest, and he never latched well, and I pumped exclusively for 5 months, and it was hard. It was really hard, and it's something that I put on myself, because I had those expectations of myself. Looking back, I probably, um, you know, I don't regret doing it, but I definitely think that I did too much I put too much on myself. And I think that we do that though as parents, is that we have these high expectations of ourselves, and we have an expectation of the way things should be and the way things, what's the ideal, and we have this ideal in our head. And I think that, like I said, every child will, you'll have a child that comes along that will just, they don't read the books. They don't know, like, why don't they read these books? And so I think that we also need to give ourselves a little bit of a break if things don't go as planned.
Yeah.
And that's okay. If you have to use formula, that is, I think that, there's this, idea that formula is bad, but actually it is a huge blessing for those families who just can't, nurse, can't have, a breastfeeding experience, and that's okay. And to think of it as there's also positives to that, because partner gets to be more involved, and maybe other family members can be involved. It's actually, so there, I mean, not that maybe it's not your ideal, but it's also okay.
Totally. Yes. All of those options are there, and that is up to every parent, every situation. So just to touch about the latching positions, sometimes we get kind of into it, and they are all suggestions of how our mothers and our community people that kind of feed their babies, put their babies in their bodies. It's a suggestion, it's an observation work, right? So we observe it, we kind of seems like that one works. But I have seen so many ways to do it. So all of them are suggestions. Maybe you try those ones, but if those ones doesn't work, cradle, football, all of those ones, please feel comfortable, right? The most important thing is that it doesn't necessarily hurt. Of course, it's vulnerable. Of course, at the beginning, kind of feels weird and different, right? Vulnerable,
I would say. Uncomfortable.
Uncomfortable. And everybody knows their bodies, right? The idea is that your body at the point that you're like, okay, no, that's my boundary, I'm not doing it, or I ask for help, or this is not okay, or right, so the idea is that you know your body, and then you decide around that. But it can be really challenging the first 2 weeks, the first 6 weeks. First 6 weeks usually you establish.
Yeah, give it have a set time where you're going to give this a good shot, because it does take work to to really get that going, that whole process, and to become comfortable with it. It really is a process, and so I give it a shot, give it some time, but that it's okay if it doesn't work. It's okay, and there are other options. So, but with my first, it just didn't happen. But with my last one, I mean, I had to pry him off with a crowbar. It was like, we're done, So, but it's, you never know how things are going to work out, because your baby and your experience is going to be different than everybody else's.
Yes, totally. And we have some points that are like, oh, I felt that way too, but I decide this, or I took that path, right? So reasons why a parent may not be able to feed baby from breast, chest, of course, illness, disease, unconsciousness, right? Maybe after C-section you lost some blood, whatever it is, sick baby, infant with special needs. So sometimes separating from the baby kind of gets that bonding and that milk supply, you know, happening. I mean, not happening on time. So then you introduce some formula or donor milk. There's lots of donor milk available. There's milk bank in Albuquerque.
I also want to include in here that another reason why you might not be able to breastfeed is a mental health. Is you need to like recognize and prioritize mental health, and that's even if there are no physical barriers, that if there is, you know, an emotional or psychological barrier, that's okay too. It doesn't, you know, it doesn't mean that you're not a good parent. It doesn't mean that you're not a good, you know, you're not there and you're not caring. It just, if it's, you have to prioritize.
Right. Yeah. Becoming a parent is a whole other world, right?
Absolutely.
So maintaining that mental health and knowing what is best for you and what is your priority. Yeah, totally. That's why the idea of, you know, this conversation that we are having now is actually not that we are the experts, but you are the experts. Yeah, like, you know. And of course, we sometimes have more information because maybe we read some research or, you know, different cases, so we can associate it and then kind of observe. I think observation is our best skill in our role. And because we know now what to see and where to look for, where to find an answer, sometimes that's why we are helpful. But usually your bodies and your process is what gives you the answers. And yeah, the options, right? You were talking about all of the options. There's donor milk, there's formula, there's hand expression, there's pumping. I don't know if you have another option, I don't know. But yeah, supporting an informed decision, right? A non-breastfeeding parent, because it's okay. Like, you are doing it, you are preparing the formula. Sometimes I think, Abby, I don't know if you agree with me, but sometimes it's harder. You have to wake up, you have to clean all of the bottles, you have to you know, when I'm seeing it, like, you usually put like extra 20-30 minutes into every session, and I'm like, wow, you guys are amazing. How like you maintain your mental health, right?
I think that the only, like, the real benefit for formula is that you don't have to do it alone.
Okay.
I think that's probably the hardest thing about breastfeeding, is that you're the one. There's
you are the one. Yeah.
You're the one. And that's something that but also but yeah, though, there's a lot involved in terms of formula, because you have to decide on, well, what nipple works for this baby, and what size of nipple, and what bottle works best, and which formula works best, because you have different tummies out there that decide that, oh, this formula is not working for me. And so there's a whole process to it. And even if a lot of times with even if you are breastfeeding and but you need to use a bottle, you're up, you know, pumping after you're feeding the baby, which is also difficult. So it's not, I feel like this is a journey that every parent needs to go on, and everybody's journey is going to look different. Yeah. But I do love that there is such a diverse experiences out there that people have gone through, that they can share with you, and that it's going to be different, and it's going to, but that's okay.
Yeah, I hear you, and I understand and validate every single path of people's lives. Like you said, every baby kind of comes with their unique idea of how it's gonna look like. And seems like when you have your first one or your second one, or you are also like a person different, or you have changed, or you have decided something different, or you are in a different job, or you professional, you are here or not, or, you know, and culturally too, right? Now we are in New Mexico, and there are so many cultural ideas of how this will look like. So opening our language, or the way that we express ourselves when we talk about these subjects, I think is also inviting, right? Like welcoming. Like, we are not against anything, we are actually welcoming any of your experiences. So then we work through and we see what what is best for you, what works best for your family. So
And that's why I love how you named this, like this whole like talk today, is you named it support related to feeding, infant feeding. It wasn't a breastfeeding video. It's not, you know, what's the best way to do things. That this is just exploring different options and ideas for families. So I really like support that, Veronica, and I love your perspective on it.
Thank you, thank you. No, I'm glad that you're here. You inspire most of it, but like this is my last you know, just kind of message, and then I pass it to you. I have to stop sharing at this point, but like you said, parenting is one of those journeys in life where so many unknowns are present every day. But confidence and courage allow the birthing parent to explore and find the best answer for their parenting style. I think we all have our own parenting style. And again, my goal is that that parenting style has to do with your identity. It has to do with something that you already know, that you saw in your mother, in your grandma, in your parents, in an auntie. Someone there was already kind of curious about this. So if you are not just remember some of that and want to, you know, copy, imitate this, like, oh, because I kind of like that style, then do it better. But like, you know, start from somewhere, gonna find those roots. And yeah, and I'm gonna pass to you and see what we can go through the emotions, because I think that is also a good part of the subject, and then maybe we close out that part. But thank you, thank you. I'm gonna stop
I think
sharing
we
that.
really touched on a lot of those emotions and touched on a lot of those ideas already, but I do think that like there's also that, you know, as you're going into having a child and feeding and the ideas that you have behind it, and a lot of that does come from your culture. It comes from your family, maybe what your mom did with your siblings. I'm the second of 8 children. And some of those are adopted children, some of those are biological children. And so it's a whole different experience, seeing it from different perspectives. But I definitely went into parenthood with some expectations of myself that didn't work out the way that that was supposed to, and so when my oldest didn't latch on, it definitely like brought up some feelings of failure and feelings of, well, why isn't this working for me? It works, and I had siblings who were having babies, and it wasn't it was a different experience for them, but also seeing the different difficulties they had also helped me in seeing that it's okay, that a fed baby is best, and that it's not a reflection on me as a parent, however it works out, and that's okay. And but I do honor like this desire, and understand this desire to breastfeed, and to have that option not be available can be devastating, and there is a feeling of mourning almost that needs to be honored, I feel like, if it doesn't work out the way you want it to. And that's true in terms of childbirth, in terms of getting pregnant, and the pregnancy experience. And when those things don't happen the way we expect them to, that can trigger some emotions in us that need to be honored and need to be recognized. So I feel like that's what's really important, is to have that support system. That support system we talked about at the beginning is finding that whether it's family, friends, maybe you attend a church, maybe you have a center that you go to that has a support system, that find your tribe, find your people, and find that support system. And we like have a really vibrant support community in Los Alamos, and they are amazing to reach out to. So if you have any questions on that, please reach out to us. We will include our website and an email for you to ask any questions if you have any at the end of this. Also, you're free to drop by our office anytime. We are at 1060 Nugget Street in Los Alamos. So please, please drop by if you have any questions or want to learn more. And we have a home visiting program. We have our early intervention program. We have a behavioral health program. We have just a lot of different, options to support you. So please reach out if you need to.
Avi, thank you. Yes, totally. That grief process, I kind of like want to just touch a point on that. That yeah, is things doesn't happen in the way we plan it, especially with parenting. Seems like that is a typical kind of feeling. Oh, I'm planning this way, and it doesn't work that way. But with the community, right? We can walk through grief process with someone, right? We cross that bridge with someone and not by ourselves. Like you said, oh, sometimes this can feel a solo idea. Like, how I'm gonna do this if I have to wash the dishes too, and I have to, go back to work 2 months from this time, or you're worried about so many things, right? And during that transition, seems like there's lots of other facts that
Paper plates in that first week home. By the way, that's my secret.
Totally, I hear you that one. So yeah, grief process happens, and the idea of sharing the story, because your story is so important, right? It's so healing. In the same way is kind of hurting you, the same story, it can be healing in your own path and with the community. And thank you, Abby. We are here in Santa Fe too. We have, of course, Española in Rio Riva County office. There's a pre-K, I know now, preschool in El Conjunto. So, all of the families that are part of our community are welcome to reach out. We are, of course, please share the webpage, and this video is there. And I think I also want to say just thank you, and I'm so glad we did it, and we share so many common experiences, and we relate in lots of ways. Yeah, thank you.
And Veronica's been amazing. She has so much insight about this. This is and now that Las Cumbres also has folks who are lactation consultants and who are available to talk to. So there are people to reach out to. If you have questions, if you have concerns, if you're just curious and you want to learn more, we're here for you.
Definitely. Thank you.